Do you sometimes feel like your child wants to say something, but keeps repeating words like "Ka, can I go?" or gets stuck on sounds? That might not just be nervousness. It could be childhood-onset fluency disorder, more commonly known as stuttering. This usually starts between ages 2 and 5, when kids are learning to talk more. Imagine trying to send a message with a walkie-talkie, but the signal keeps cutting. The words are there, but they can't come out smoothly. Many kids grow out of it, but some don't. That's when help can make a big difference. Have you noticed a child speaking this way and wondering if it's normal? What causes stuttering? It's not because kids are scared or raised in a bad home. No. It's more about how the brain controls speaking. Think of the brain as a busy traffic director. In kids who stutter, the signals between the brain and mouth don't always sync up perfectly. Some kids inherit it, like how some families have curly hair or tall height, others pass down stuttering. Also, if a child's brain grows super fast in language areas, the moving parts might get a bit out of order. So, like a car that's too powerful for the driver, the words rush but stumble. Did you know that about 60 to 80% of people who stutter have a family member who did too? How do you know if it's normal disfluency or real stuttering? Let's play a quick game. Picture two kids both saying, I want juice. One does it once in a while, the other does it every sentence, blinks hard, or clutches their hands. The second one might be struggling. Signs include repeating sounds, like BB ball, stretching sounds, milk, or suddenly freezing with no sound. Some kids look away, blink fast, or seem upset when talking. A child might avoid saying their name or skip words they think are hard. For example, instead of spider, they say the creepy thing. If this happens often for more than 6 months, it's time to look closer. Can a doctor just look and say yes, stuttering? Not quite. A speech-language pathologist (SLP) is like a talking coach who listens carefully, records the child, and watches how they speak at home and school. They check how often the child stutters and how hard it is for them. No blood tests or scans. Just smart observation. Treatment, it's not about stopping stuttering instantly. It's about helping the child feel confident. One method is slow talking. For example, the SLP might tap slowly, while saying let's walk slowly when we talk too. Some kids learn easy speech techniques. Parents are trained too, like pausing more during chats, so the child doesn't feel rushed. Early help equals better fluency later. Can we prevent stuttering? We can't stop it if it's in the genes, but we can create friendly talking spaces. Imagine if every time you spoke, someone finished your sentence. Frustrating, right? So, avoid interrupting the child. Instead of saying, calm down and talk slow, just wait patiently. Use turn-taking games like Storyball, toss a ball, and only the catcher speaks. Slow, calm talking at home helps. Praise the message, not how it sounded. Say, I loved your idea about the dog, instead of why are you stuttering? Less pressure means more freedom to talk. Small changes, big impact. Scientists are now using brain scans to see how kids who stutter use their brains differently when talking. They have found slight differences in timing between brain areas that plan and produce speech. Cool, right? Also, apps are being tested where kids play games that teach gentle speech, like a voice meter that turns green when they speak slowly. One study even used real-time feedback with animated characters that reward smooth talking. Another big idea, treating stuttering very early, even before full symptoms appear in kids with family history. It is like training wheels for the brain. Progress is slow but hopeful, like planting seeds and watching them grow.